about another important issue, and that is about COVID spike. Case count is increasing every single day. 7,500 plus COVID cases have come in just 24 hours. Should you worry? India's top doctor tells you what you should be doing with this rise in numbers.
OLX ऑटोज ही देता है आपकी कार का बेस्ट प्राइस।
क्या बात कर रहे हो?
यही कि OLX ऑटोज ही देता है आपकी कार का बेस्ट प्राइस। ये प्राइस नहीं, सरप्राइज है। विजिट olxautos.in।
Joining us on Mirror Now today is renowned cardiac surgeon and Narayana Health Chairman Dr. Devi Shetty. Thank you very much, sir, for taking out time for us today. It was important to speak with you today because India's COVID count is going up every single day. 7,500 plus cases have come yesterday. Is it the fourth wave? How concerned are you with the current spike?
Realistically, if there was no COVID test, India had no third COVID wave. During the third COVID wave, newspapers were reporting lakhs of positive patients, and we prepared ourselves with few hundred beds in our hospitals, and there were no patients, hardly any patients. We had 800 beds and there are 23 patients. So my impression or my belief is that this is again going to be the repetition of the same thing. Large number of people are going to be tested positive, but they will have mild symptoms and they may not need hospitalization. So my opinion is that we all need to be careful with social distancing. All our vaccine should have been taken. We should be very careful, but do not disrupt our routine because of the increasing number.
That's a very important point you have made. And I then want to ask you, is it a new strain that we are talking about? Is it Omicron only?
See, I am not an expert in this area of microbiology to find out, or a virology to understand these complex issues. All I want to tell you is that so far, the third wave and the current wave, whenever you say people are turning out to be positive, they remain symptomatic for just 1 or 2 days. It is virtually passing off like a bad flu. So it doesn't matter what strain is. Virus is doing its job. It has to mutate. The strain has to keep changing. Of course, the virologists have to keep tracking, understand what is happening. There is I'm not saying nothing will happen, but these can be pretty unpredictable. But all I am trying to say is that looking at the past of Spanish flu lasted only for 18 months. So COVID also lasted more or less for the same month, 18 months, yes.
What kind of symptoms, Dr. Shetty, are people coming with this time? We understand hospitalization rate continues to remain low. That's a number we need to watch out for. A lot of people are not even getting tested despite coming in contact with a COVID positive person.
You know, it's a very hard, you see, for us to say that everyone who is in contact with the COVID patient, positive COVID patient must undergo a test, right? It's a bit difficult to implement because people want to get back to their normal activities. But the only message I have is that let the country not get excited and carried away with the number of positive patients, which is getting reported in all the media forms. It has an impact on the people's way of thinking, the sentiments of the people, sentiments of the business community. how long we are going to be controlling our entire activity with the fear that there may be a new strain of COVID coming that may disrupt our life. I think time has come for us to get back to our routine. But we should be vigilant, we should be careful, we should vaccinate ourselves.
The message clearly you're trying to send is that we need to learn to live with COVID. But
Yes.
any specific, symptom that people need to watch out for? And if indeed they see something like that, then they need to get themselves tested. Because a lot of people around us also might have flu-like symptoms. They take rest for 1 or 2 days and then they are back at work. And, they can also be carriers. So what will you recommend in a scenario like this?
I'll tell you what is happening in US. First thing is, all the insurance companies are branding COVID as a common flu. Okay. Second, when a doctor or a nurse turns out to be positive, they tell them to go home, rest for 5 days, come back for work. Don't bother repeating the test. Come back for work. And I feel if they have done this, I'm sure they would have done a lot of thinking and a lot of research before coming up with a simple solution. I think this is what we need to do as well. We are no different than Americans.
Dr. Shetty, can drop in temperature that is now going to happen due to monsoon lead to a further surge in cases or increase the transmission rate?
See, knowing the nature of the virus, there will be large number of people who will get tested positive. There may be millions of people getting tested positive, but that doesn't mean anything. Are we testing people for malaria? Are we randomly testing people for dengue or a common cold? We don't do it. So if somebody comes with a serious problem to the hospital, we are testing them, obviously. Otherwise, forcing people who are asymptomatic and asking them to go for the test, I think this may not be required, at least as of now. Yeah, but we need to be careful. Whatever I said now may not stand good after 1 month if situation changes.
We need to be careful.
We should be very clearly watching for all the developments and take the right step. Right now, my message to people is that don't panic, don't get carried away with the number of positive patients. Just count the number of patients in the hospital. Based on that, let's take the decision. That's what we do in most of the viral infections.
I'm asking you. Absolutely. Why I was asking you again on what needs to be done, because COVID is still wreaking havoc in parts of China. There is lockdown kind of situation there in parts of China too, from where it all started. And here, once again, when we thought that probably, we all have now learned to live with COVID, the restrictions went away. Masks are no longer mandatory in a lot of states where the spike is visible today. For example, Maharashtra, despite a rise in COVID, despite a high contribution to the daily COVID count that we are seeing in the country, the mask is not mandatory. Do you recommend at least masks being made mandatory, if not testing anybody and everybody who's come in contact with a COVID positive patient, if that person is asymptomatic?
See, the first thing is about your first observation about China. China didn't have COVID. We knew that they're just postponing the inevitable. We predicted this more than 1.5 years ago. And we requested all the industries which were dependent on China for all their materials and raw materials and components, that you better stack up everything what is required, because China will be in trouble. China will be in trouble. China will be in great trouble because people were not exposed to COVID. This is exactly what happened in Kerala. Kerala, during the first wave, they did a phenomenal job. of controlling. But during the second wave, when the whole country was free of COVID, Kerala had COVID because this virus will not spare anyone. You may lock down and hide from the virus, but when you come out, it will catch you. Unfortunately, Chinese administration doesn't realize that they are only postponing the inevitable. And as you keep locking down, restricting, you're only going to prolong this problem until people are infected, they become vulnerable. But India, we did a very smart thing from the very beginning. We went for early lockdown, prepared ourselves, developed the vaccine, got all the required ingredients of PPEs and all the rest of it in a record period of time. So we have done, compared to all the other countries in the world, India has done the best. I can confidently say that.
And what about the mask mandate? Do you think that needs to be now brought back, or we're okay?
I think we should leave it for the time being, because every time government comes up with the new enforcement, people get panicky. And we have to understand the impact of all the panic reaction we create on the lives of the common man. When people get scared, if they stop allowing the maids to come to their house to work, if they stop interacting and going out and buying something what is required, entire economic activity will come down, and that is not going to affect the rich people. It is the poor people who are going to bear the brunt. We have to realize that. And if it is meaningful, I can understand. Do we have evidence to say that doing all these things will have an impact? Our hospitals are empty. There are no patients with COVID.
Well, that might not be a very good news for you, but for viewers, for us, that sounds like a good news that at least because of COVID, the hospitalization rate continues to remain low.